Hello everyone, welcome to another video. My name's Dr Parissis. I'm a hair transplant surgeon and hair specialist based in London, UK. Today I want to talk about a question that I get asked all the time. I get questions like, Dr Parissis, I'm 25 years old, am I too young to have a hair transplant? I might get patients who are 23 years old asking me, Dr Parissis, am I too young to get a hair transplant? And I even get patients as young as 18 years old asking me whether they are old enough to get a hair transplant. And this really asks the question, how young is too young to get a hair transplant? When performing a hair transplant on anyone, we like to ensure that the hair loss is slow and stable. And if you've lost hair at a very young age, this indicates that your hair is very sensitive to DHT, the hormone that causes hair loss. And in some cases, hair loss can actually progress very rapidly in young patients because of this. Now, it's not really ideal to perform a hair transplant on someone who is rapidly losing hair because it creates difficulties with surgical planning. Hair transplants take about 12 months to grow in, and if during that period of 12 months you have experienced more hair loss, then it can actually give quite a disappointing result. We may have used fewer grafts than you may have needed in the end if you have lost native hair during that 12-month period. And also your result could be unnatural if you have further recession behind the area of transplanted hairs. It's therefore most ideal for our patients to be on 5-alpha reductase blockers to slow down hair loss so that they have the best chance of achieving a successful result from their hair transplant. So then you might think that why don't we just start all patients on 5-alpha reductase blockers and just perform a hair transplant? Well, 5-alpha reductase blockers are not really advised in very young patients. Since 5-alpha reductase blockers interfere with hormones and hormones are involved in puberty, 5-alpha reductase blockers can interfere with puberty and therefore interfere with normal male development. Things like the development of pubic hair, of normal muscle mass, bone density, and height are all things that we do not want to interfere with in puberty in men. Now, there is no research paper that defines the exact age at which men finish puberty and then therefore could possibly start 5-alpha reductase blockers like finasteride and dutasteride. But this one did find that puberty can continue in men throughout their 20s. And from my clinical experience, I've actually seen men continuing pubertal development usually up until the age of 21. So I usually recommend against anyone aged 21 and under taking finasteride or dutasteride, since these men still could be undergoing minor pubertal changes up until that age. Tying this back to hair transplants, I generally do not recommend anyone to have a hair transplant aged 21 and under, and that's because anyone aged 21 and under may be undergoing puberty still and therefore can't take a 5-alpha reductase blocker, and therefore we can't stabilize their hair loss. And we really want hair loss to be stabilized before undergoing a hair transplant. There you've got it. Really, it's age 22 and over that we can start considering our hair transplant. Now, there are other factors involved in making that decision, and these factors I will dive into in a future video. As I said, I am a licensed doctor working in London, UK. I do perform hair loss consultations where, if you're interested, we can go through your current stage of hair loss, your family history of hair loss, your likely progression of hair loss, as well as whether any medical treatments might be appropriate for you, and finally whether you might be a candidate for hair transplant surgery. If that's something you're interested in, do shoot me an email at drparissis@gmail.com, and see you in the next one.